In this video, the 7 most dangerous kidney toxins on Earth. Gathering here, let's talk about the number 1 danger for the kidneys: toxin exposure. The kidneys are the filtering organs of the body. It's not a secret that toxins damage them. But when I mention toxins, most people will think about what they eat or the environment they live in. But what if I told you that when it comes to kidney health, the toxins you should be most worried about are not those you get from food or from the environment, but those that are prescribed by your doctor? Yes, the worst toxins for your kidneys may be those in your medicine cabinet. It's recent news that a woman with kidney disease sadly passed away due to a prescribing error. A common medication that was prescribed to her caused complete kidney failure. The reason? The nurse that prescribed the medicine forgot to account for the decreased kidney function of the patient. And yes, that was enough to cause this patient, that the newspaper refers to as Mrs. E, to pass away due to complications of kidney failure. And guys, I want to be very clear on this. These kind of medical errors are way more common than we are led to believe. This is why I want you to be proactive, alright? I want you to check if the medications you are taking are safe for you. Because otherwise, there is no improving, there is no reversing the decline of kidney function if we don't aggressively stop the toxins in our medications from damaging our kidneys. Because keep in mind that the damage medications can potentially do to the kidneys is several orders of magnitude bigger than anything else. Not even diabetes and high blood pressure can do the damage the wrong prescription can do. Now at this point, many people will tell you that it's the doctor's job to make sure that the patients are safe, alright? And that's completely true. But we have just seen what can happen when doctors make mistakes. This is why when it comes to your kidney health, you should be proactive, you should get informed. And today I won't just tell you what are the dangers you should be on the lookout for. I will also give you natural alternatives that are safe for the kidneys and that will get the job done. We will also see what medication was given to Mrs. E, the patient that passed away. But before that, there are 7 common medications that are way more dangerous than people realize. We will see what they are now. Let's start with a medication that a huge number of kidney disease patients are taking, and that's more dangerous than most people realize. The diabetes medication, or metformin. This may come as a surprise for some since a huge number of diabetes patients take metformin. But it presents some dangers for people with kidney disease, and I think that you should know about that. But why is metformin dangerous? Metformin is cleared from the body through the kidneys, alright? And of the main risks associated with metformin is lactic acidosis. This is something you should know about, especially if your GFR is below 45 or if you also take a diuretic. Also drink a lot of water if you are prescribed both metformin and a diuretic. Why, you may ask? Well, since the kidneys are supposed to clear metformin, in people with a reduced kidney function or dehydration, this medication can accumulate and it can cause a dangerous condition called lactic acidosis, which is a buildup of acid in the blood that comes with weakness, muscle pain, trouble breathing, and dizziness. Not very common, but dangerous nonetheless. So it's important to know that patients with a GFR below 30 or stage 4 of CKD should not take this medication at all for this reason. Another risk of metformin is vitamin B12 depletion. This is very bad because it can cause or worsen anemia. So always supplement B12 if you are taking metformin, and also consider a natural alternative. How can you avoid the dangers associated with metformin? Well, the strategy to control diabetes while protecting the kidneys must be based on lifestyle and dietary modifications, alright? Guys, changing your diet, exercising more, and giving up bad habits can really go a long way in reducing the dependency on medications that can accumulate and become toxic. And if you have type 2 diabetes in particular, it's imperative that you focus on a healthy diet and lifestyle, because the alternative is taking medications that can damage the kidneys. And there are also natural substances you can use that have a similar effect as that of metformin, but with less risks. One is berberine, and berberine is very powerful, almost as powerful as metformin when it comes to improving insulin sensitivity. If you want to learn more about berberine and how to use it for blood sugar control and weight loss, my video up here is for you. Up next, another medication that most consider safe, but that actually comes with a toxic risk. Cholesterol medications or statins. Statins such as Lipitor, Zocor, Mevacor, Altoprev, and more are very commonly prescribed, but their side effects are also very common. And statins are even more dangerous than metformin. Now, statins are usually given to anyone with an LDL cholesterol level above 100 milligrams per DL, alright? And the reason is that high cholesterol correlates with heart attacks and strokes. And statins can effectively reduce the amount of cholesterol the liver makes, but they also damage the kidneys. So what to do if you are prescribed a statin and you are worried about your kidneys? First of all, make sure you are taking the lowest possible dose. Many doctors prefer to protect your heart rather than your kidneys because there is no dialysis for a heart attack. But protecting both can be possible as long as the correct dose of statin is used. This is why you should talk to your doctor if you are taking a statin and make sure the lowest effective dosage is used. Studies tell us that the risk for kidney toxicity here is dose dependent, alright? So the higher the dose, the bigger the risk for the kidneys. Statins also have other side effects such as muscle pain, and they are also linked to CoQ10 depletion, which can also make statin side effects worse. If you follow me here regularly, you probably already know how important CoQ10 is. It was even used in dialysis patients as a way to actually get them to stop dialysis. Yeah, it's incredible. And watch that video if you missed it, by the way. It's up here. So CoQ10 is clearly something you don't want to be deficient in. But not many doctors will tell you to supplement CoQ10 when taking a statin. And not all doctors know that the dose for this prescription must be lower for kidney disease patients. So be careful and double check with your doctor that your dosage is right for you. There are also natural alternatives to statins you may consider, especially phytosterols. Science tells us that adding 2 grams of phytosterols per day can produce a reduction of 8 to 10% in bad cholesterol levels. And that will go a long way in reducing your need for statins, especially if used in combination with diet and exercising. Yeah, I know, I'm a broken record when it comes to lifestyle choices. But I have just one more medication that you can replace with diet and exercise, and then I'll stop, I swear. And I'm talking about blood pressure medications. Just like for statins, taking blood pressure medications in general is a trade-off between heart and kidney health. I'm especially talking about ACE inhibitors such as lisinopril, enalapril, and ARBs or sardans such as losartan, valsartan, and so on. These are very controversial today because while they are supposed to protect the kidneys, recent studies found out that the damage they do is basically on par with their kidney protecting ability, especially in people with advanced kidney disease. ACE-I and ARBs are known to cause decreased blood flow to the kidneys and high potassium levels. And when combined with NSAIDs or diuretics, or when the patient is dehydrated, they can also cause acute kidney injury or very fast damage to the kidneys. How do we avoid that? As I was saying, your best bet to reduce your dependence on these medications are the correct lifestyle choices. Regular exercise in particular is extremely effective in lowering blood pressure. Always keep in mind that medication side effects grow almost exponentially with the dose, alright? Your goal should always be to take the smallest dose possible. And there are also natural remedies that can help, especially magnesium, but also garlic and L-citrulline. Guys, taking these supplements in the right way can really make a difference in reducing your need for medications. This is why I made a full video about them. It's up here and also down in the description. But don't watch it now, save it for later. It's time to learn about some medications that are extremely dangerous for people with kidney disease. We will also see what medication was given to Mrs. E. That's our number one for today. But it's not the only potentially lethal medication. If you are prescribed one of the next entries, be extremely careful. PPIs or proton pump inhibitors such as omeprazole, Prilosec, Nexium, and pantoprazole. These are used to treat acid reflux and heartburn. A lot of people take them every day without knowing that these medications damage the kidneys, even in otherwise healthy people. And obviously, you should be very careful with these medications, especially if you have kidney problems. Luckily, there is an alternative. If you have acid reflux, ask your doctor about H2 blockers like Zantac or Pepcid, as they are way less likely to damage the kidneys than PPIs. And yes, your doctor should know this, just like they should know that NSAIDs are one of the most dangerous medications, at least in terms of number of people affected. NSAIDs such as ibuprofen, naproxen, aspirin, and many others. The rule here is that if it's for pain, it's usually bad for the kidneys, unfortunately. These are the definition of nephrotoxic medications. They have direct toxic effects on the kidney cells. Always avoid taking them, especially on the long term. Now, when it comes to pain medications, the general consensus is that Tylenol, also known as acetaminophen or paracetamol, is safer for people with kidney disease. And it's true that it's safer than NSAIDs. It's also the favorite choice for pain relief in kidney patients, but it's not actually 100% safe for CKD patients. It can still cause kidney damage, says a recent review of studies. It's safer than NSAIDs, okay, that's true, but it's not without danger. So yeah, paracetamol is better than NSAIDs, but you should still be careful if you need to use it for extended periods of time. Up next, what can do damage even faster than NSAIDs is antibiotics. Antibiotics can be extremely dangerous for the kidneys, especially for people with kidney disease. These medications are a known cause of fast kidney damage. And while all doctors know that prescribing an antibiotic course to a kidney patient comes with several challenges, antibiotics are only used as extrema ratio in CKD patients with shorter courses and lower doses. I won't go in depth about this because this is something doctors should be worried about, not patients. So my advice here is, if your doctor says you need an antibiotic, make sure they know very well you have kidney disease, alright? There are reported cases of people with serious kidney damage because doctors prescribe them antibiotics without checking their kidney function. Okay guys, it's time now to see what medical error caused Mrs. E to pass away. So let's talk about medical errors. Yes, you may be surprised to know that medical errors are today one of the most dangerous causes of kidney toxicity and damage. And it can be bad. Let's see why. The patient, Mrs. E, was in her late 60s and had various chronic conditions including end-stage kidney disease, congestive heart failure, and obstructive sleep apnea. She developed a rash on her neck. Her regular primary care physician, whom she saw regularly for the treatment of her chronic issues, was on vacation, so she went to her local walk-in clinic for care. Walk-in clinics may be a recipe for disaster for kidney patients. This is not the first time I see people losing their lives because they are given prescription by doctors that don't know them. And this is what happened to Mrs. E. She had a case of herpes zoster, which is treated with valacyclovir. Now, the problem is that valacyclovir is extremely dangerous for the kidneys. This medication, just like antibiotics, is cleared by the kidneys, which means that in patients with kidney disease, it can accumulate and become extremely toxic. The patient was brought to the hospital and emergency dialysis was used to clear the medication. It wasn't enough, and she sadly passed within a month. Now guys, way more people are affected by medical errors than we may realize. It's recent news the story of a 42-year-old veteran that reached a record of 10.5 million settlement after the wrong prescription caused him a total renal failure. He was given the wrong prescription, just like Mrs. E, but he survived. However, since he trusted his doctor, he went on for years taking a medicine that slowly destroyed his kidneys. And at just 42, he ended up in dialysis. And if you want to learn more about how to avoid this kind of errors happening to you, this video up here is for you. And this is all for today. Thank you for watching. God bless you all. Bye!